Hello everyone and welcome to the Health and Wellness Spot. Now I am Dr. Lewis. Now in this video we're going to talk about tonsillitis and tonsillectomy. Is tonsillectomy really necessary in our children? Why do we chop off those tonsils? So tonsillitis is basically an inflammation of the tonsils, and tonsils are two glands that are basically behind your throat. Okay, so their role is just to trap harmful microorganisms that are headed into your respiratory tract, which can cause you upper respiratory tract infections. So these tonsils trap these microorganisms and then help you to prevent your lungs or your upper respiratory tract from getting infections. Now, once they trap these microorganisms, sometimes they get overwhelmed and they start to swell. That swelling is what we call tonsillitis. Most of you call it tonsils. However, tonsils is the gland. And when it starts to swell and start to have that pain, that is what we refer to as tonsillitis. Now, tonsillectomy is the surgical removal of these glands. Okay, so most of you take your children for removal because when they become recurrent and your children have problems with these tonsils, you take them to a doctor and they are removed surgically. That is what we call tonsillectomy. So in this video, I'm going to handle the two and possibly tell you if I prefer or if I don't prefer tonsillectomy. But from the word go, you already know that I don't prefer cutting off or inhibiting or even reversing a biological process. So I believe each organ in your system exists because of a function, and that also applies to tonsils. So tonsils are not supposed to be removed because they are the first line immunity or defense mechanism of the body. Just the same way when you go to hospital, you've hurt your toe or you've had your toenail removed, and then you have a gland that is swelling at your groin area. You don't go to hospital to cut off that gland at your groin. You go to hospital and treat the infection, and then you start to recover, and then the gland goes back to normal. I wonder why we cut off tonsils, yet they're just indicators of the immune system, and they communicate to us. They tell us upper respiratory tract has infections and it's time that you treat them. And also, they show you that your immunity is already compromised. Your child's immunity is already compromised, and therefore cutting them off is totally compromising your child's immunity. So recurrent tonsillitis can be problematic, but it doesn't guarantee surgical removal of those tonsils. And surgical removal, I already told you, is in a process that is called tonsilectomy, just like vasectomy. So we are not supposed to reverse biological occurrences or biological functions. These organs are there for a reason, and a specific reason for that matter. So we don't need to remove them. Instead, treat infection, because once you have these swelling tonsils, you realize that that is an infection of the upper respiratory tract. And therefore, the best way is to treat infection. You can use, first of all, you go for a diagnosis so that we realize or we know what type of infection you have, whether fungal, whether bacterial, or whether viral. And so that we narrow down our treatment to a specific causative microorganism. So treat infection, you can use antivirals, you can also use antibiotics for 5 to 7 days, and that is enough. And then your tonsils will start to subside once the infection disappears. Number 2, you can improve your child's immunity. And how do you improve your child's immunity? We've already talked about this over and over. We've talked about the diets. So get your children off sugar. Get your children off sugary stuff, sweets, soda, wheat products, processed foods. Ensure that even fruit juices, and so ensure that your children do not consume these products. Also margarine and seed oils. These are highly inflammatory, and this will cause a reduced immunity in your child. Because now once you get that reduced immunity, then your child is prone to infections. So most of the parents, you give your children soda, you give your children biscuits and wheat products, you give your children chapati, you give your children noodles, you give your children margarine and bread. And then afterwards, you start complaining that the child's immune system is compromised and your child is having this recurrent tonsillitis, and therefore your doctor advises you to cut them off. It might seem like a good idea, but it is not wise. So do not chop off those tonsils. Again, make sure that your children use salt to brush their teeth, and also they can gargle salt water. This is a very effective therapy for this. As we conclude this video, it's important that you know that surgical removal of tonsils is not an effective way of management of tonsillitis. And therefore, you can forget any other thing that we've mentioned in this video, but do not forget to feed your children with good food, healthy food, and nutrient-dense foods. Also, do not take your children for tonsillectomy, okay? Because those organs exist for a specific reason. And finally, maybe to just mention some of the complications of tonsillectomy. This can include severe bleeding, because once you cut off those tonsils, then you expose your blood vessels to bleeding. Again, this can lead to anemia. Number two, you open up the wound, you bring about infection, because remember, you've not treated the infection. Therefore, this wound can be a source of infection and therefore sepsis. Then we can also have difficulty in swallowing. So these children will have a problem in swallowing food, and that will lead to malnutrition. And then lastly, a temporary or permanent loss or change of voice. So this can be very detrimental to your child, and therefore just feed your children with healthy diets. That is enough. And if you have infections, go for the diagnosis and then utilize antimicrobial therapy to the maximum.